Hello, my name is Dr. Joel Becker. I'm the founder and director of Cognitive Behavior Associates and the Cognitive Behavior Therapy Institute. Today we are having the first in our series of conversations with clinicians in the Los Angeles area. I have the honor of welcoming today Dr. Berta Davis. Berta is not only one of my colleagues, she's also a close friend and a terrific therapist in her own right. Today, Dr. Davis, Berta, is going to be talking with us about a particular aspect of her work. Berta is a diplomate of the American Association of Sex Educators, Counselors, and Therapists, referred to as AASECT. What I'd like to start with is having Berta tell us a little bit about the organization and what it means to be a diplomate of this organization. Welcome, Berta.
Thanks, Joe. AASECT is the governing body which really makes sure that services are being provided to people who are struggling with issues of sexuality and intimacy. It's the organization within the world which has set certain criteria which they feel are necessary when you're working with someone with problems in the area of relationships and intimacy. And I've had the pleasure and honor of being certified by them, a supervisor and a provider of continuing education. So I'm fairly linked in with the organization and within their principles, which really believe that sexuality is such an enormous part of our life, but so difficult to really talk about our feelings, our needs. And sometimes professionals who are very have excellent intentions, have some difficulty in feeling comfortable in talking about their clients' sexual needs and problems.
What are some examples of the kinds of problems that come to you under the heading of the sex therapy work you do?
There are really two major reasons why people will come to see me. One, I would say, is that it's based upon anxiety concerns or performance concerns. More specifically, men's concerns are they going to get it up? Are they going to keep it up? Will they be able to pleasure their husband or their wife? The woman might be concerned, is she going to be able to reach orgasm? Is she going to come quick enough? These are examples of concerns that men and women have when they are either about to be sexual or during the time that they're sexual. And these intrusive thoughts will often take over, and they don't have really the ability to just focus on the pleasure and the experience because there's such chatter going on in their head, which really takes them away from the experience of delight which sexual connection is supposed to be about. Second area that's really of tremendous distress to so many people is issues connected to sexual desire. What we do know is that desire changes with time, and how hot and wonderful and fabulous sex can be when you're with a new partner or at the beginning of a relationship or possibly when you're on vacation. We know that that level of passion does not stay constant throughout a lifetime, and there are many changes that occur. So it's with really great regularity that people will come to see me who are struggling because either their passion has changed and or they don't feel the kind of passion that they would like to feel for their partner. And that whole area, the awareness of the lack of sexual desire or sexual passion, has really become a forefront to those of us who are working in the area of sexuality and relationships.
I heard you mention that you think that frequently the way a person is thinking is part of what goes wrong. You mentioned that in particular in the performance anxieties or evaluation. And of course that interests me as a cognitive behavior therapist. Could you comment a little on how do you think that you deal with those thoughts that are problematic, both in a way that's similar to a cognitive behavior therapist and or perhaps different?
Those thoughts are what we consider intrusive thoughts. They're thoughts that are going on within the head of the person. And our goal very much is to help a person realize that those are thoughts, and thoughts come and go. And if they can, instead of concentrating on the thought, they can go back to concentrating on what it feels like, what pleasurable sensations are like, what it feels like to touch or to be touched, rather than getting hung up on the thoughts and or the anxiety. So part of the process in working as a sex therapist is that we use a number of very specific techniques. One of them is what we call sensate focus, in which the person is given an experience, or the couple is given the experience of very gradually doing exercises of increasing level of intimacy and physical connection in a way that they're encouraged to feel the delight and pleasure of touch as compared to the anxiety of, let's say, penetration or orgasm. So a first exercise might be about touching a hand or a foot or a face, very non-threatening parts of the body, and to learn how to enjoy that, and to learn that if there are going to be intrusive thoughts, that thoughts come and go, and that you don't have to stay focused on either the chatter in your mind or what I'll call the laundry list of thoughts, but you can stay focused on the experience and the pleasure. Another thing is, we've become very involved, at least I have, in the area of working with mindfulness. And mindfulness is so much based upon staying in the present, staying in the moment, ridding one's mind of the chatter, ridding one's mind of planning on what's going to happen next, and just staying focused on the here and now. So these are two areas that I think are very similar, have either borrowed heavily from behavioral therapy, but I think originally sexual therapy originated in the 60s, and it was very much considered a behavioral method of working with concerns related to sexual performance and pleasure.
Well, Berta, despite the fact that you referred back to the 1960s and the origins of behavior therapy, and I am familiar that some of the early procedures in sex therapy came directly out of the behavior therapy literature, what it seems that you're talking about today would actually put you in the forefront of the newer cognitive therapies. Mm-hmm. So when you start to use terms like mindfulness, of course that is part of what we call third wave cognitive behavior therapies, and I certainly can see how you are moving clients into the present moment with activities like sensate focus, and taking them out of the future, taking them out of the past, getting them into that experience in the present.